The ventral and dorsal groups are each divided into a superficial and a deep layer. As mentioned before, due to its innervation, the radial muscle group is often merged with the dorsal group on the forearm to the extensors of the wrist. As you can see, it is hard to separately look at the closely packed muscles of the forearm in this picture. We will talk about individual muscles in these compartments one by one. We are going to start by learning about the ventral superficial group. Now what you see here is the left forearm, with the radius on the right ulna on the left side. First, we have the pronator teres muscle. It has two heads, the humeral and the ulnar. The humeral head arises from the lower part of the medial supracondylar ridge and the medial epicondyle of the humerus. The ulnar head arises from the medial border of the coronoid process of the ulna, immediately below the origin of the flexor digitorum superficialis. The muscle runs downwards and laterally for its insertion into the middle of the lateral surface of the radius at the maximum point of convexity. The median nerve enters the forearm and passes between the two heads of pronator teres, thus giving the branch to the muscle, as it passes between the two heads of the pronator teres muscle. As for the action of the pronator teres muscle, it is the muscle of the flexor compartment of the forearm, so its action is flexion and pronation at the forearm. The next muscle in the ventral superficial group is the flexor carpi radialis. It takes origin from the medial epicondyle of the humerus, the deep fascia of the forearm, and the intermuscular septa. The muscle runs along the medial side of the pronator teres. The tendon begins in the middle of the forearm and passes through between the superficial and the deep part of the flexor retinaculum, attached to the margins of the groove. But what is this flexor retinaculum? The flexor retinaculum is a band of deep fascia in the region of wrist and hand. At the posterior aspect, we see the extensor retinaculum, which holds the long extensor tendons in place. The flexor retinaculum holds the long flexor tendons in position at the wrist. It stretches across the front of the wrist and converts the anterior surface of the hand into an osteofascial compartment known as the carpal tunnel for the passage of median nerve and flexor tendons of the thumb and fingers. Coming back to the flexor carpi radialis muscle, it carries a synovial tube along with it. It is inserted into the second and third metacarpal bones. The tendon of flexor carpi radialis is considered a royal tendon as it passes through a separate tunnel. It is also supplied by the median nerve. Action. It is the flexor of the wrist joint along with the flexor carpi ulnaris. As it lies on the radial side, it also acts as an abductor of the wrist, along with the extensor carpi radialis longus and brevis. The third muscle that we are going to talk about is palmaris longus. It lies medial to the flexor carpi radialis. It arises from the medial epicondyle of the humerus, the deep fascia of the forearm, and the intermuscular septa. The tendon of the muscle beings higher up in the forearm and runs on the medial side of the flexor carpi radialis tendon. It passes in front of the flexor retinaculum and gets inserted into the palmar aponeurosis. Part of it is also inserted into the distal half of the flexor retinaculum. This muscle is known for its variations and absence. Supplied by the median nerve, it performs its action at the wrist by flexing the hand. The next muscle in the superficial group of the anterior compartment is the flexor carpi ulnaris. It has a humeral head that originates from the common flexor tendon and an ulnar head that originates from the medial aspect of the olecranon process of the ulna and the posterior border of the ulna. The two heads unite to form a long tendon which is inserted into the pisiform bone and into the hook of the hamate and base of the fifth metacarpal bone. It is the only muscle of the anterior compartment that is not supplied by the median nerve. Instead, the ulnar nerve innervates this muscle. Its action is like the flexor carpi radialis. It flexes the wrist joint and adducts the hand at the wrist joint, also called ulnar deviation of the hand. The last muscle of the anterior compartment is the largest superficial muscle of the forearm. It is called flexor digitorum superficialis. This muscle is an intermediate muscle, meaning that it is neither superficial nor a deep muscle of the anterior compartment of the forearm. This muscle also has two heads, the humerulnar head and the radial head. As the name suggests, the humerulnar head originates from the common flexor tendon, attached to the medial epicondyle of the humerus and the medial margin of the coronoid process of the ulna. The radial head arises from the oblique line on the anterior surface of the shaft of the radius. The muscle's two heads unite to form the muscle belly, and in the lower part of the forearm, this gives rise to four tendons. These tendons enter the hand by passing behind the flexor retinaculum. It is supplied by the median nerve and flexes the middle phalanx of the fingers and assists in flexing the proximal phalanx and the hand. That ends our discussion on the superficial muscle of the anterior compartment. Before moving ahead to the deep flexors muscle, let's just summarize the 5 muscles we have studied so far. A neat trick to learn the superficial layer of the anterior forearm is to use your fingers as the models. Place your thenar or hypothenar eminence over the medial epicondyle and fan out 5 fingers with the thumb resting below the 4 fingers, as shown in the figure. The 4 fingers represent superficial flexors, while the thumb represents the intermediate or the middle flexor. Starting from the index finger count, pass, fail, and fail. A mnemonic to remember these muscles is Preddy found Pamela for fight, where each word denotes the name of the muscle as follows: pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, flexor digitorum superficialis, and pronator of the forearm. These muscles are named as flexor digitorum profundus, flexor pollicis longus, and pronator quadratus. Keep in mind that these are the deeper muscle, and upon dissection, they are covered by the superficial muscles of the forearm. First, let's discuss the flexor pollicis longus. It arises from the upper 2/3 of the anterior surface of the shaft of the radius and from the adjacent part of the interosseous membrane. Some fibers arise from the medial border of coronoid process. The muscular belly changes into a tendon through its course. The tendon passes behind the flexor retinaculum and is inserted into the base of the distal phalanx of the thumb. This muscle is supplied by interosseous branch of the median nerve. As its name suggests, it's a flexor of thumb. The next muscle is flexor digitorum profundus. This muscle originates from the upper 3/4 of anterior and medial surfaces of the shaft of ulna and adjoining part of interosseous membrane. The muscle has 4 tendons, which pass under the flexor retinaculum deep to the tendons of flexor digitorum superficialis. Each tendon passes through a division in the corresponding tendon of superficialis muscle and is inserted into the base of the distal phalanx. This muscle is innervated by two nerves. The medial half is supplied by ulnar nerve, while the lateral half is supplied by the interosseous branch of the median nerve. The action of this muscle is that it flexes the distal phalanx of the fingers and assists in flexion of the middle and proximal phalanges. It also assists in flexion of the wrist. The third muscle belonging to the deep group of the anterior compartment of the forearm is the pronator quadratus. This muscle originates from the lower 1/4 of the anterior surface of the shaft of the ulna. It is a small muscle that inserts into the lower 1/4 of the anterior surface of the radius. It is also supplied by the interosseous branch of the median nerve. The muscle pronates the forearm at the proximal and distal radioulnar joint. So that was all about the three deep muscles of the anterior compartment of the forearm. An overview of the muscles in the forearm's anterior compartment will now be given to help boost your memorization. Here you can see a cross-section of the forearm. The muscle of the anterior compartment is highlighted here. The four superficial muscles are the pronator teres, flexor carpi ulnaris, palmaris longus, flexor carpi radialis, and an intermediate muscle called the flexor digitorum superficialis. The mnemonic and trick to memorize these muscles have been discussed earlier. As for the three deep muscles of the forearm, you can remember them as the 3P. Flexor pollicis longus, flexor digitorum profundus, and pronator quadratus. They are easy to remember due to the fact that their names indicate their actions. As for the nerve supply of these muscles, remember that the muscles of the anterior compartment of the forearm, superficial and deep both, are supplied by the median nerve and its branches, with the exception of flexor carpi ulnaris, which is supplied by the ulnar nerve. In the coming section, we will talk about the nerves in more detail.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.